Hello, my name is Dr. Louis Sclafani, and I'm the Health Director for Medical Products Online. Today, we're going to talk about a TENS device called the MPO 6100, which is a 5-mode TENS device. Please remember to consult with your own physician or healthcare professional before using any of these devices. The MPO 6100 is a professional TENS unit that is used in many healthcare offices today. Your unit comes with everything that you need to get started. A set of electrodes. There are 4 electrodes in there. The device itself, the 6100. The battery compartment is located in the back. A power adapter and a set of lead wires, as well as your battery. In order to get started, you would press the power button located in the lower left side of the device. What we're going to do right now is flip through the modes. We have a burst mode, and then the normal mode, modulation, and then the strength duration 1 or SD1 mode, and then SD2. What we're going to do now is we're going to set up some of the parameters within one of the modes. So we're going to take the normal mode. In normal mode, we would press the set button in order to change the pulse width and the pulse rate and also the timing of your treatment. So when we press the set one time, we are into the parameter for width, pulse width. In order to increase pulse width, you would select the up arrow located underneath the set button, and then if you want to decrease that pulse width, you would hit the down arrow. If you hit the set button one more time, you will then be able to change the pulse rate anywhere from 0 to 50 to 150 cycles. If we hit the set button one more time, we are then able to change the timing of your treatment, and you can change this anywhere from 15 minutes to continuous or up to 60 minutes in a time cycle. In order to get started, we're going to turn the unit off. Always remember to turn your unit off before making any connections. Here we have a wire that is already connected to electrodes. Please make sure to make your connections tight so that they're not loose, and both on the electrode side and on the device side. So we're going to do a treatment in the normal mode. Once again, normal mode is when the pulses and the current is continuous and does not turn on or off and does not fluctuate. So now that we've made these connections, we're going to do a treatment to the extensor part of the forearm. This might be for a tennis elbow situation. And what we're going to do is turn the device on by holding the power button, and then we're going to select the mode to normal mode, and we're going to press the set button, and we're going to change the pulse width down to, in this instance, down to 45. And we're going to press the set button again, and it is currently set at a default at 150, which is a good pulse rate. And pressing the time again, the set button again, we're going to set the time at 30 minutes by pressing the down arrow. And then we're going to select, we're going to wait until the unit is ready to go and the numbers stop flashing. Now we're going to increase the amplitude or the strength setting by pressing the up arrow located to the left of the mode, because we're in channel 1, until we begin to feel stimulation. Stimulation should be set at a comfortable level. You want to feel it, but you don't want it to be too strong, and in TENS we don't want to have muscles contract. So we want to be just under the point where muscles will contract. And then we will wait for the duration of our treatment, and when our treatment is finished, we'll then once again turn the unit off by holding the power button and then disconnecting your unit. Please remember to care for your unit by sealing your electrodes back in the bag and putting them on the protective plastic sheet that comes in there, and then store your unit in a dry, cool place, and you'll have it for many years. Please remember to consult with your own physician or healthcare professional if you have any questions regarding the use of these devices. Thank you very much for joining us.